Our next speaker is joining us from the Office of National AIDS Policy at the White House. Dr. Aaron Lopata is on detail to that office from the Office of Management and Budget. And for those of you who are familiar with Washington, OMB sort of controls all the books. So it's wonderful to have those two offices working so closely together. He's also a pediatrician, so he understands from a provider point of view all of these issues, and he's worked on national AIDS policy issues for quite some time. He's working with HRSA and with other federal agencies to make sure that grantees are prepared for this transitional year of 2014. So I think based on the conversations we've been having today, his comments and his availability for questions will be perfect way to connect these dots. Prior to working at OMB, he's also worked as a health policy fellow for both Congressman Henry Waxman and Congresswoman Jan Schakowsky, two leaders in the House on healthcare issues. So welcome.
First, thank you so much for inviting me to speak to the Academy. I really appreciate the opportunity. And then I realized when Dr. Parham Hobson had mentioned that what else is there to say after Dr. Cha, our esteemed panel. I'm in even a worse position because now I have to follow Dr. Parham Hobson as well. But I thought that what would be perhaps helpful would be to discuss and talk about these issues from the perspective of the Office of National AIDS Policy and as an extension, the Office of Management and Budget, since I am full-time at the Office of Management and Budget, and right now for the late spring, well, from the late spring to early fall, I'm at the Office of National AIDS Policy, so I am somewhat wearing two hats here. What do we see as our role in addressing these issues from this perspective, which is sometimes 10,000 feet height, and we're obviously not on the ground, but we are trying to learn as best we can what's going on the ground and what the challenges are. And so I want to discuss a little bit what we're looking at and what we're really trying to do. I think one of the reasons I was invited to come over to ONAP from OMB, I should state that I've been at OMB for 8 years. I've been working on the Ryan White program and had the pleasure to work with Dr. Parham Hobson and her team for 8 years now. And so I think one of the reasons I was asked to come to the Office of National AIDS Policy was to in part work on these issues, one of which is, well, the overall issue of ACA transition. One, first trying to get a better sense of how ACA transition, or beginning in 2014, is going to impact the Ryan White program and get an idea of the impact on the Ryan White budget and the impact on Ryan White program programmatically, so we have some idea of what to expect when we start looking at the 2014 budget this fall. And of course, the other issue is how do we work with and understand better the challenges faced by Ryan White grantees, but all federal grantees that work with the HIV/AIDS population, whether they're health departments, whether community-based organizations, and of course, whether they are providers. And what are the challenges they're facing going into 2014, or what are some of the things that they're going to have to do and be prepared for starting in 2014 when all these changes happen and the expansions of health insurance, and what kind of assistance do they need? And I think one of the things I think is obviously key is providing technical assistance, of course, and in order to do that, we need to understand very clearly what the challenges are. And everybody has talked about it today a great deal, what the challenges are, and there are many. And I think I'd like to also note that, as others have stated here, there's also great opportunities, but there are, of course, great challenges. And I think one of the things we're trying to do and I'm trying to do this summer, is learn from providers, and that's also helped listening to some of the discussions here, but also having calls, meetings with providers and learning what are their needs, what are the problems, what are the challenges, and what kind of technical assistance do they need, and in order to prepare and be ready for 2014. And not just providers, but also state health departments and community-based organizations. And I think this is really important because, well, let me state that one of the other things that we're constantly doing at the Office of National AIDS Policy is also trying to implement the National HIV/AIDS Strategy. And then you have those challenges as well. And that also requires a new way of thinking about things. And the strategy's done a great job of focusing on, what do we have to do? How do we refocus our funding to the areas of greatest burden? How do we coordinate federal resources better? Not only at the federal level, but on the ground. How do we work with communities to implement coordinated systems or more coordinated systems to implement effective cascades, outreach, to testing, to linkage to care, retention and care, which I think has even gotten a higher profile now with the treatment as prevention, the recent research showing the effectiveness of antiretrovirals when, obviously people are virally maximally suppressed, of preventing transmission of the virus. I think there's even more of a focus now on helping communities implement these types of effective cascades, and it doesn't just require one provider or one clinic or one health department. It will take and is taking communities working together, and health departments, community-based organizations, and providers all working together as a team. But of course, you have that challenge, and then you have the ACA, which is a tremendous opportunity, but there's all those challenges that come with it. And so we really want to be able to help providers and all federal, whether you're a federal grantee or not, be able to deal with this transition in a way that when 2014 comes, you're not so overburdened that we're not able to do these other things that will, again, be required for communities to implement this effective cascade. And I think one of the things I've known for a while, and I think is the other component of what we're trying to do, is when addressing, so you have all these issues we've talked about today in terms of challenge of ACA, but one of the things that is not new to people who are any federal grantee for any agency is the current reporting burden that grantees are facing, again, from all agencies. And how that is making, I think, implementation of national strategy more difficult when, again, you have these challenges and we're asking communities to do more and coordinate more. And then on top of that, and then you have all this work that has to be done in terms of the ACA transition. So we're going to be asking people to do even more while there's also all this reporting burden that is, again, I think remained a very significant problem. And it's a problem that is not the fault of any one agency or all agencies. It's OMB deserves responsibility as well, and I think that this is something that we're going to be focusing on a lot over the next few months and over the next year. You know that the Secretary of HHS had released a memorandum calling for not only development of core indicators, which the Assistant Secretary at HHS, that office is getting ready to release, but also to reduce the reporting burden by 20-25%, which we would like to think is at least 20-25%. And I think, though, as part of that process, that we at ONAP and at OMB could work with the department to sort of address the area from the top down as well, and figure out what can we do to help the agencies find flexibility. Again, that's not in statute. As Dr. Parham-Hobson said, the statute is certainly a limitation, but I think there's places where we can make a lot of gains outside of the statutory requirements, where we can make some changes that I think will really help free up the federal grantees, whether you're a provider or whether you're a health department, so they can focus more of their resources on actually providing services rather than spending so much time pulling data manually, from one system to another, or doing a report every month on something. And so that's the other thing we're going to be focusing on, because again, I think it's going to be an issue that has to be addressed if providers are going to be able to deal with the ACA changes that are coming in 2014, and I think also if we want to see effective implementation of the strategy continue. And I'll also say that, one of the other issues we will also want to focus on is this, and this has also been discussed, is the challenge in terms of the burden on providers. And in terms of, and again, I think we saw this, or we have seen this in Massachusetts to some degree as well, that the providers have been strained after they passed health reform, and this is not something new. This has been a concern not just among the HIV/AIDS population, but among the across the country generally. After the Affordable Care Act was passed, are there enough primary care providers? And then the second question, of course, we were dealing with today: are there enough HIV/AIDS providers? And so I think these are unique challenges that we also want to continue to work with the agencies, work with HRSA to address. And I think there are different ways to address this, whether it's through the AETCs, whether it is through the Bureau of Primary Health Care, and I think it's also working with the HRSA's Rural Health Policy shop, as well, as they have unique ways of providing expertise to specialists in rural areas, but I think we can use, such as telehealth, telemedicine, that we can also use for primary care providers, whether they're in health centers or not in health centers, to provide the specialized HIV care. And so I guess I want to end by saying we, and I say we at ONAP, and I will continue to do this when I go back to OMB, are constantly in a state of listening and learning from providers on the ground. Not only providers, but also, again, state health departments and community-based organizations, is what are the challenges that everyone is facing, and when and where we can, how can we address them? And of course, this also involves working with the agencies, listening to the agencies, for them to tell us what are some of the limitations they're facing, what are the challenges that they also have that we can, at OMB or ONAP, can respond to as well, to help them provide the assistance, technical assistance, or any other type of assistance to their grantees. So going into 2014, we are in a better we're in a better position to handle the ACA transition, and in a good position to continue making progress through the implementation of the National HIV/AIDS strategy that we've made such good progress so far. I hope that, well, I know that will continue, but I think addressing a lot of these issues, including a lot of the issues that we talked about today, is going to be a key part of that. So.